My name is Lindsey Schwartz. I'm a master's student at the Information School, and this past year, I've been working with Dr. Nick Weber, an assistant professor at the I School, on an ongoing study about independent contractors working for on-demand platforms in the Seattle area. So think apps like Uber, Lyft, Amazon Flex. Our aim is to better understand their experiences working prior to and through the COVID-19 pandemic, and in particular, the effectiveness of policy protections established by the City of Seattle's Office of Labor Standards. What I'm going to cover in the next 4 minutes is the context for our research, what we've accomplished so far, and some preliminary findings that we're using to guide formal analysis. The increased demand for delivery services at the onset of the COVID-19 pandemic in the US drew attention to the essential work performed through lockdown. To provide legal protections for gig workers during COVID, the wage bump and paid time off appear designed to buffer the financial and health-related consequences of this essential work. And understanding how effective this legislation is in Seattle is informative both for local policymakers and for other municipalities looking to implement similar protections. There is no singular definition for gig work. It's typically described in terms of temporary work arrangements and the presence of an intermediary. The participants in our study work primarily for ride-hail and delivery companies. Some of them also find work through staffing applications and Craigslist forums. Nearly all of the participants we spoke with find work using multiple apps. A little over half had 3 or more years of gig work experience, and the majority worked anywhere between 10 to 30 hours per week. From these 3 points in time, we have anecdotal evidence about how participants' work routines and livelihoods were impacted by COVID, as well as their perceptions about the benefits and shortcomings of the city's ordinances. These focus groups provide a baseline. The first round of interviews captured the immediate effects of the pandemic in Seattle, and the follow-up interviews represent a less heightened time where there's a better collective sense of how COVID is transmitted and the early stages of vaccine distribution and lifted municipal restrictions. Despite popular narratives about the flexibility of these types of jobs, often described as the ability to work when you want, gig workers, especially those working in delivery and ride-hail platforms, have a measured amount of control relative to that of the company when it comes to consistent availability of well-paying work, and they're continually striving to achieve financial and temporal stability. The anecdotal evidence our participants shared corroborate what has been reported in news articles and in emerging scholarship in the past year and a half, that the pandemic exacerbated what were already challenging working conditions. A few themes that we are working through in our analysis are the trade-off between material stability and physical health, and the strategies gig workers use to exercise agency and create their own stability within the constraints of the platform. Many participants prioritize the revenue from the increased demand for services over the associated health risks, as well as the prospective financial burden of severe illness. We expect this is related to the relative dependence on income earned from these jobs, including those who rely on it as supplemental income as opposed to a full-time job. Many who were working in ride-hail before the pandemic switched to grocery and package delivery to reduce contact with others, as well as access availability of work and generous tips. The roles of peer groups were a commonly cited way that participants overcame the lack of formal training and employer support normally, and this normally is in like prior to the pandemic. And this continued as workers navigated the lack of structured guidance from companies about COVID protocols and the overall uncertainty and fears that come with a public health event. In terms of attitudes around policy, participants expressed very little faith in companies to do right by their workforce without legal enforcement. They consistently expressed a desire for material benefits, such as paid sick time, and largely preferred independent contractor status over traditional employment for the perceived flexibility. As we further examine the efficacy of local ordinances, these initial observations help clarify the commonly cited advantages and disadvantages of gig work. And they prompt us to investigate why participants value the degrees of flexibility they have within platform work and how to design policy that supports these desired affordances while holding companies accountable to the people powering their platforms. and thank you.